This is my first go at an Epley's manoeuvre self-help video for the coronavirus era. One particular kind of dizziness is called benign paroxysmal positional vertigo. It can be treated by the Epley manoeuvre. You can find out if it's going to work by doing something called the Dix-Hallpike manoeuvre, which is the first part of the Epley's manoeuvre, and the likelihood of it curing your dizziness is 90% if you've got benign paroxysmal positional vertigo. So if you do the first part and you feel dizzy, the rest of it's going to help. If you do the first part and you don't feel dizzy, the rest of it won't make any difference. If you're feeling dizzy all the time anyway, it's not going to help. Normally a doctor guides your head, but during coronavirus, you probably don't want to get your face that close to somebody else's. The doctor certainly won't. Don't try this until you've watched the whole thing, because there'll be tips and tricks that you pick up along the way. The first stage, the Dix-Hallpike manoeuvre, involves turning your head 45 degrees to one side and tip it back 30 degrees, and then you lay back suddenly over a pillow. Wait there for a minute before deciding whether it's worked or not, because sometimes you get a delayed onset of dizziness. If you feel dizzy, it works. If you don't feel dizzy, try it on the other side. Stage 2. Wait for the dizziness to settle, or a whole minute's elapsed, whichever is longer. Turn your head to the opposite side. Wait for the dizziness to settle again, and then keep turning your head so that you're looking down slightly towards the bed or the floor, sort of skirting board level, so that you've turned your head a whole right angle, like this. Wait until the dizziness has settled, and then tuck your chin down onto your chest and sit up. Wait until the dizziness has settled again. Now, after the procedure, it's really quite important you try not to lie on the affected side, avoid any sudden head movements for a few weeks, and try to sleep as upright as possible for a few days. This is quite challenging because effectively it means don't be sociable. You'll notice that when people converse with one another, they naturally nod and shake their heads. This is what you've got to try and avoid doing. There are a few useful tips that you can learn. The first is to move yourself to the centre of a large bed so that you don't fall off and hurt yourself. It also enables you to throw your arms out so that when you do feel dizzy, you've got some stability. Have a few goes at positioning the pillow so that it's comfortably under your shoulders and your head's in the correct position. It can make you feel sick, so it's worth having a bucket to hand or something else to catch the vomit. Otherwise, you've got to make your bed all over again. Normally, doctors like to keep your eyes open so that they can watch your eye movements, but if you're doing it on your own, you don't have to worry about that, so closing your eyes can help minimise the sick feeling. Repeating the procedure is 90% likely to work, so have another go if it hasn't worked the first time. If this doesn't work, talk to a doctor. There are many other causes of dizziness other than BPPV, and you may have one of those. Exceptionally, it can make dizziness worse, but in that case you need to go and see an ear, nose and throat specialist or an audiological medicine specialist who should be able to help you. Don't drive if you experience any sudden or uncontrolled dizziness.